This is McMurray's test. With the knee fully flexed, externally rotate the tibia, introduce a valgus force, and extend the knee. Repeat with the tibia internally rotated and a varus force applied to the knee. A click along the medial or lateral side would indicate a meniscus tear. This is Houston's posterior medial drawer test. Apply a posterior force to the proximal tibia. Increased posterior tibial displacement, particularly of the medial tibial condyle, is indicative of a posterior medial rotary instability. Houston's posterior lateral drawer test. Apply posterior force to the proximal tibia. Increased posterior tibial displacement, especially of the lateral tibial condyle, is indicative of posterior lateral rotary instability. This is Jacob test. The examiner externally rotates the tibia with one hand and applies a valgus force with the other hand while slowly extending the knee. A palpable clunk or shift as it approaches extension is indicative of a posterior lateral rotary instability secondary to damage of primarily the PCL, LCL, posterior lateral capsule, and arcuate complex. This is Clark's sign. The subject is asked to contract the quadricep muscle while the examiner applies a downward and inferior pressure on the patella. Pain with movement of the patella or an inability to complete the test is indicative of chondromalacia patella. This is patella ligament length test. The examiner measures the distance between the superior pole of the patella to the inferior pole of the patella. The examiner next measures the distance between the inferior pole of the patella and the tibial tubercle. A ratio is taken between the first and second measurements. A ratio of greater than 1 indicates patella baja, while a ratio of less than 1 indicates patella alta.